Hello all. In this video, we are going to talk about a very important topic, that is routes of drug administration. Now this topic is divided in two videos. In this videos, we are going to stretch more about local routes, and in the next video, we are going to study in great detail about systemic routes. Starting with the local routes, and before that we'll proceed ahead with some introduction. Now, as we know, most of the drugs are administered in human body via different sources or different routes. In this, drug and patient relationship plays a very important role, and in order to determine that, we have various factors such as characteristics of drug, emergency and routine use, site of action of drug, local or systemic, condition of patient, whether unconscious, in conscious state, or having certain side effects such as vomiting, diarrhea. Age of patient is a very important factor. Effect of gastric pH, digestive enzymes, first pass metabolism, patient and doctor's choice sometimes. Now, in the routes, we have two broad classification: local route and systemic route. Now, the systemic route is further divided as enteral and parenteral. In enteral, we have subclassification as oral, sublingual, rectal, and in parenteral, we have inhalations, injections, and transdermal. The systemic classification of routes we are going to see in the next video. Here we'll be talking about the local routes. Now, what are the local routes? In this video, in a pictograph, you can see and comprehend here. This is the oral route, a capsule. Then you have your sublingual and buccal. These are also included in your oral or your topical route. Then you have applications. In local, you have a classification as topical. So again, application on the skin or mucous membrane. Then you can have your optic and ocular also as a oral source, and also the rectal. These all are included in your oral routes. Whereas you can see the parenteral has intravenous, intramuscular, and subcutaneous. So which is, parenteral doses are that is injected via a syringe or some kind, that is, directly the drug is directly passed into the systemic circulation. Whereas in oral, or you can say local routes, it is the simplest mode of administration of drug. Where the desired action is required, it works at the local site of action. Okay, and systemic side effects are very minimal. Seeing further classification ahead. Now, the local routes has the first classification, that is topical. Subclassification, there are three subclassification of local routes. First is the topical, second is intra-atrial route, and third is the administration of the drug into some deep tissues. So let's see what are topical. Topical is something that is applied on your skin or mucous membrane, and the local action is provided to that drug at the site of location. Okay, a local action or a common action is provided where the drug is applied. So first we have oral cavity. In oral cavity, what are the things that we can intake as a source of drugs? So we have suspensions, example nystatin. We can intake it as a troche, that is clotrimazole for oral candidiasis. As a cream, topical cream, example acylclovir for herpes labialis. As an ointment and jelly, example you have 5% lignocaine hydrochloride, that is used as a topical anesthesia. As a spray, example 10% lignocaine hydrochloride, also used as a topical anesthesia. Then you have GI tract, that is gastrointestinal tract. In that you have a tablet that is not absorbed. generally tablets are also, you can say, uh, it is through the oral cavity, but the tablet is not absorbed by the systemic circulation. So you have example as neomycin, which is used for sterilization of gut before a surgery or operation. Then you have rectum and anal canal. Now in rectum and anal canal, you use it as an enema or you use it as a suppository. So administration of drug into the rectum in the liquid form is enema. You have two types of enema: evacuant enema and retention enema. Evacuant enema is used for the evacuation of bowel movements. For example, soap water enema, which acts as a lubricant and stimulates the water that is present, stimulates the rectum. Then you have retention enema, for example, methyl prednisolone in ulcerative colitis. Okay, whenever there is a condition of ulcerative colitis, the retention enemas are inserted to the rectum. Then as a suppository, you have administration of drug in solid form into the rectum. Example, you have bisacodyl for evacuation of bowel again. Then as I said, optic and ocular, these are nothing but your ear and eyes drops. Optic is something eye related to eye, that is eye drops, and ocular is your ear drops. And nasal sprays or nasal is your nasal related. Pharmaceuticals are your nose related. So as you can have drops, ointments and sprays for conditions like allergic conditions, infections, or certain conditions like you have soreness, redness, etc. Example is your gentamicin, which is used as an eye or ear drops. Then you have bronchi, as an inhalation you use the pump, which is again coming under topical. Example, salbutamol, ipratropium bromide, etc. For bronchial asthma and chronic obstructive pulmonary disease (COPD), it is used. Okay, skin also, as I said, skin is a major subclassification of topical, wherein you apply to skin or mucous membrane. Example, you have various anointment, cream, lotion, powder, serums you have, etc. Alright, example, you have clotrimazole, which is used as an antifungal for cutaneous candidiasis. Cutaneous candidiasis is a type of infection or itching redness produced on the skin. Then you have intra-atrial route. Now this route is rarely employed. It is mainly used for diagnostic studies such as coronary angiography and for the administration of some anti-cancer drugs. Example, treatment of malignancy involving limbs. Now an intra-atrial route जो होता है, this is very rarely employed and this is majorly used for diagnostic studies and coronary angiography for administration of some anti-cancerous drugs. Okay, examples you have for treatment. Now here the term is malignancy. Malignancy is nothing but it is a type of cancer. Okay, malignancy is nothing but a tumor. It is a classification of cancer. Okay, malignant cells. Then you have administration of drug into some deep tissues. Now this is comes under topical, but this is given as parenteral source, that is you use injections, and it is example you have administration of triamcinolone directly into the joint space in the rheumatoid arthritis. This is majorly given to the athletic person who has certain injury in your, or the person that has rheumatoid arthritis. These injections are given to them in order to directly relieve the pain into the joint spaces. Then we have systemic routes, which we will be covering in our next video. I have a summary of the entire routes. Let's talk about that. Okay, so this is a chart or the table I will be providing you in the video, so you can take a printout of it or you can note down it. This is a summary of entirely what we have talked. It has route of administration, absorption pattern, advantages and disadvantages. It also have the systemic classification. But now we have done with oral, so let's see what is there for oral. It is variable. Absorption pattern is variable, affected by many factors. Advantages: safest and most common, convenient and economical route of administration. Disadvantages: it has limited absorption of drugs. Food may affect absorption. Patient compliance is necessary. Drugs may be metabolized before systemic absorption. Then we had talked about erratic and variable. Partially bypasses the first pass effect. Bypasses destruction by stomach acid. Ideal if drug causes vomiting. Ideal if patient who are vomiting or comatose. Drugs may irritate the rectal mucosa, not well accepted route. Then you have inhalation, that is systemic absorption may always occur. This is not desirable. Absorption is rapid and can have intermediate effects, ideal for gases. Effective for patients with respiratory problems. Dose can be titrated. Localized effect to the target lungs, lower doses usually compared to that of the oral and parenteral administration. Fewer systemic side effects are seen. Most of the addictive route drug can be entered to the brain quickly. Patient may have difficulty in regulating dose and some patients have difficulty using inhalers, such as your senior citizens. Sublingual depends on the drug. Few drugs, for example nitroglycerin, have rapid direct systemic absorption and erratically incompletely absorb. Bypasses first pass effect, bypasses destruction by stomach acid. Drug stability maintained because of pH of saliva relatively neutral, may cause intermediate pharmacological effects. Limited for certain types of drugs. Drugs can be taken in small doses and may lose a part of drug. Now this summary is telling about the absorption pattern, advantages and disadvantages. So this is little bit different from the topic, but yeah, it is useful. So if you go through it, it will really help you. Thank you. Please subscribe my channel and do watch the second part for better understanding of systemic classification. Thank you all.